So my name is Lindsay Smith. Thank you for joining us from whatever region you're coming from today. I work at the Global Fund in the Access to Funding department, and I've been working with lots of the colleagues at the Global Fund and some external stakeholders to prepare for this presentation today to equip those of you who are working in high impact and core portfolios on what you can do now to already start preparing to develop your full review application package. Next slide, please. What we're going to be covering today is we're going to be talking about the thematic areas of what you can plan for between now and when you get your allocation letter. And then once you have your allocation letter, we'll be going through the section on developing the funding request. And my colleague, David Nash-Mendez, will be presenting to you the different questions that are in the funding request document that we're expecting the core and high impact portfolios to complete. Then we'll go through how to submit the funding request, a recap on the resources, and then we'll have some time to answer your questions at the end of the presentation. I want to mention up front that this presentation is for core and high impact portfolios, core and high impact countries. And so this is not appropriate for focused portfolios. So if you are working in one of the Global Fund's focused portfolios, we will be having a separate presentation for you in March. And so this is specifically designed to talk about the full review funding request, which is what is going to be expected from our core and high impact portfolios. Okay, so let's get going. Next slide, please. Preparing for the funding request means, first of all, getting into the right expectation of what Grant Cycle 8 has in store for us. The starting point for that is to recognize that we are in a different reality now with Grant Cycle 8 in 2026 than we were in Grant Cycle 7 when we were working on our funding requests 3 years ago. We all need to acknowledge that we're adapting to new realities in the public health financing landscape. And for example, while the Global Fund had a very successful replenishment, we were delighted and felt very supported by all the pledges that came in for the Global Fund's Grant Cycle 8 replenishment. We also need to recognize that the funding that has been pledged is less than it was in Grant Cycle 7. And this is a change that we all need to adjust to, both within the Global Fund, but also we know that this is affecting your countries as well. And so the countries that you are working in very likely have a very different public health financing landscape than you did 3 years ago, or even than you did 1 year ago. And this is something that will result in us all needing to think differently about how we prepare for the next grant cycle. An area, for example, that we would expect as an area of shift or adaptation in the countries that we work with is the idea of integration. And you've heard this theme already, and there will be another presentation on integration presented by the Global Fund. So you'll hear more about this, but integration is not only thinking about how we bring together HIV, TB, and malaria programs with Global Fund financing, but also how we think about integrating HIV, TB, and malaria even more in depth in the primary healthcare system and support system overall. We will need to be thinking collectively about how value for money should be a key driver in all of our health investment thinking. We'll need to continue prioritizing populations that are most at risk. And it is certainly an expectation that specifically for the high impact and core portfolios, we do expect that your investments in human rights and gender programming would continue in Grant Cycle 8. We need to be thinking about how we can be equipping our countries that we work with for sustainability and transition readiness. And that is in that you will see a difference in our co-financing commitments that are expected for Grant Cycle 8. They have evolved. The expectations for those co-financing commitments have evolved. And you'll be hearing more about that as well in a separate presentation. The final point here in terms of GC8 strategic shifts and adaptations is that we have an opportunity to accelerate scale up of new health product innovations. And this will help us reduce incidence and ensure that we're able to successfully deliver on our mission, to sustain the gains that we've made and to maximize the potential for the future of Global Fund investments alongside domestic commitments, alongside other commitments from other donors as well. So this is the environment that we're now working in. And in this context, let's ground ourselves in the timing. Next slide, please. Grant Cycle 8 timelines in 2026 certainly are more compressed than they have been in past funding cycles. Instead of receiving an allocation letter in December, you will likely be receiving your allocation letter. If you're an eligible portfolio that's designated an allocation, you would likely receive that at the beginning of March. And that's due to the delay in the Global Fund's replenishment and the delay in the final decision about the sources of funds available for the allocation. That decision is still pending. That will be made by the Global Fund Board in February. And following that decision, we'll be developing the allocation letters to then communicate the decision about allocation funding to those portfolios that will be receiving an allocation in Grant Cycle 8. Between the allocation letter and the first funding request submission window, there's about 3 months. And that's the same amount of time as you would have had in previous funding cycles between the allocation letter and window 1. But what is compressed is the time for grant making that happens then in the rest of 2026. We note that the majority of our Global Fund grants end at the end of 2006 and would be expected to begin at the beginning of 2027 if they receive additional funding for Grant Cycle 8. That means that between the allocation letter and when the grants need to be signed to be able to ensure that there's no disruption in implementation, we have less time for the funding request and the grant making altogether. So we've recognized that, and we're going to be talking to you today about one option of how you can advance some of that grant making work to do that alongside the funding request development to be sure that your grant documents are ready in time to submit them in the last quarter of 2026. There will be 3 windows for funding request submission in 2026, and there will be multiple opportunities to submit your grants leading up to quarter 4 to ensure that they're approved in time, reviewed by the Global Fund's Grant Approvals Committee, and then approved by the Global Fund Board before the implementation then begins in 2027. If you do have grants that are ending at the end of 2026, and that's not all portfolios, although many do fit this criteria, you need to be thinking about having your funding request ready for submission in window 1 or window 2. Window 3 would be for funding requests that are supporting grants that extend into 2027 already. Next slide, please. So, how do you think about what you can do now to then make sure that you're well prepared when your allocation letter comes to be able to dive in and hit the ground running? The first thing that you can be thinking about is already planning your country dialogue discussions. Who should be involved? What should they be discussing? And planning those meeting times, sending out the invitations in advance. You can anticipate that you'll be able to receive your allocation letter in the first half of March. So you could already think about scheduling some of those discussions now to start looking at your programmatic gaps in your country and doing that analysis so that by the time you receive your allocation letter, you're able to start those discussions about how to optimize that funding and what to prioritize in the funding request. I don't think that we should assume country dialogue should look the same for Grant Cycle 8 as it has in the past. We would encourage you to be considering how to tailor your country dialogue to the scope of change that's expected. We know that many of the Global Fund portfolios engaged in substantive discussions in summer of 2025 when we needed to reduce the funding that was designated for Grant Cycle 7. Because that reprioritization has happened, you should be able to build on some of those discussions that you were having in 2025. And you don't need to reopen the question about what should we invest in from scratch. Country dialogue should be about refining what's working and identifying where those programmatic gaps are that would need to be addressed, and then deciding, is it global fund funding? Is it domestic funding? Is it other funding that might be available to make sure that you are addressing the most important programmatic gaps for your particular country context? In our allocation letter that we will be sharing, there is a section called the aims of the allocation. This section will specify areas that the Global Fund would encourage you as a portfolio, as a country, to be considering as you think about your prioritization. Overall, we would expect that our countries, with this idea of integration being a theme for Grant Cycle 8, to not have the siloed discussions about HIV, TB, malaria, RSSH separately, but instead to have a holistic discussion. How best should the allocation funding be used to make the biggest impact in your country context? It's important to keep in mind as well that the Global Fund CCM eligibility requirement does require that this discussion, these country dialogue discussions, are done in an inclusive manner that includes the key populations that are specific to the country context. Next slide, please. One of the decisions that the CCM is responsible for that needs to happen between when you receive the allocation letter and before the funding request is submitted is a decision about the program split. The Global Fund will be communicating the recommended split between the eligible disease components in the allocation letter. And yet the CCM, as the representative body of the country, needs to be discussing this and very critically assessing where that investment should be best used in this holistic discussion around where the programmatic gaps are that will make the biggest difference. We recommend that each country think in advance, where are the RSSH, the Resilient Sustainable Investments for Health, going to be the most impactful, not only for each disease, but a cross-cutting lens is very important at this point. And so in the program split discussions, we will be expecting that the core and high impact portfolios are identifying the indicative funding for RSSH, the planned funding for RSSH that's going to be supported by each of the allocation amounts for the 3 diseases. This needs to be documented in the program split confirmation form and submitted before the funding request. If a CCM proposes a change in the program split, it is also necessary to include the justification for why you propose this change. And maybe that's because you know that there will be more domestic funding in this particular disease area, and so you can shift some of the funding to a different disease. In that program split change justification, it would of course need to be signed by the CCM chair, vice chair, ensuring that the civil society representative also endorses that. And that needs to be submitted before the funding request and agreed before the funding request can be reviewed by the technical review panel. Next slide, please. One of the early questions that the CCM will need to be deciding is which components, HIV, TB, malaria, and RSSH, which components are going to be included in the funding request or funding requests. Now, I want to just preface this by saying that we have seen in the Global Fund a significant improvement in the integrated thinking in the past cycles already between TB and HIV. So we've seen a lot of joint TB and HIV funding requests, and that's great. We would encourage you to consider developing one single funding request for all of your eligible components and RSSH in one document for the coming funding cycle, for Grant Cycle 8. If that is not a possibility for your country context, then it is still possible to submit separate funding requests for the different diseases. But if you do that, they all need to be submitted in the same submission window. And all the investments for RSSH are required to be in one of those funding requests. They should not be split or scattered across different funding requests. We will be expecting to see demonstration of integration thinking and integration, programming, and planning in the funding requests that are coming for Grant Cycle 8. Next slide, please. The other area that CCMs need to be thinking about early, and you can start discussing this now and then make your final decision when the allocation letter arrives, is you need to be discussing implementation arrangements for Grant Cycle 8. All portfolios in the Global Fund ecosystem are encouraged to consider how to simplify implementation arrangements, reducing the number of PRs, streamlining the number of sub-recipients that are executing the implementation identified by the principal recipients. Considering value for money, this will help us shorten the time that's needed for grant making if we have a smaller number of implementation partners. We're advising you to consider early confirmation of your principal recipients because this will not only help you improve the quality of the funding request, but it will also advance some of the grant-making opportunities that are available to you. Let's go on to the next slide and I'll explain a little bit more about the opportunities to advance that grant-making. For Grant Cycle 8, we are introducing a new option that CCMs can consider. They will still be expected to complete the full funding request package that includes the narrative and all of the annexes that have been identified as necessary for Grant Cycle 8. My colleague David will talk you through this in just a moment. But what is different for Grant Cycle 8 is that we are allowing CCMs to consider whether or not they want to nominate their PRs early and then request that the principal recipients develop the grant level performance framework and detailed budget and include those with the funding request submission package instead of a funding request performance framework and detailed budget. So the classic option is still available. This is where the CCM chooses to develop a funding request level performance framework and detailed budget. That is still an option, and it will be required if you have a change in any of your principal recipients that are included in the funding request. But if the CCM chooses to nominate a principal recipient that has been previously working in the Global Fund system as a principal recipient, then that CCM can ask the principal recipient to do the grant level negotiations on the performance framework and detailed budget for the grant, and then be able to use those for the funding request submission. So this is a way to advance the grant making work at the grant level and already be including the principal recipient at the stage of the funding request development. It's still the CCM that is responsible for identifying the priorities that need to be included in the grants, because it is the CCM's responsibility to then have the designated funding transformed into grants, yet the principal recipient would be the one that would be doing the actual negotiations with the Global Fund on how those details would then play out in the performance framework and detailed budget. Next slide, please. So for the grant ready funding request, which is what we're talking about, this submission pathway, the CCM would nominate their principal recipient, and if it was an existing principal recipient or principal recipients plural, they would then inform the Global Fund of the components in the funding request, inform them that they want to use the grant ready submission pathway, tell the Global Fund which window they will be coming in, window 1, window 2, window 3, or in 2027, there will be future windows. Then the CCM would proceed to develop the funding request narrative, the annexes like the programmatic gap table, funding landscape table, but the principal recipient would start developing the grant level performance framework and detailed budget. The principal recipient would do the performance framework online and the detailed budget in an Excel. And the principal recipient is then able to use the online health product management tool that is in the Global Fund's partner portal. This HPMT is not required for the funding request submission, but it certainly provides helpful detail to be able to complete the detailed budget. So that would be shared with the Global Fund, but it is not part of the funding request package and is not reviewed by the technical review panel. When the principal recipient completes the grant level performance framework and detailed budget, they submit that to the CCM, and the CCM would then be able to review that, compare it to the funding request narrative, make sure that the grant is consistent with what has been described in the funding request as the priorities for funding. And then the CCM, when they are happy with that submission, would forward it to the Global Fund as the CCM submission that would then undergo the technical review panel review. After the TRP review, there may be comments from the TRP that would need to be addressed. There would still be final grant making to complete, so there is still the opportunity to update the performance framework and detailed budget after TRP review, but the time frame that would be needed to complete that grant making would be less than it would be if we use the classic funding request option. Next slide, please. The classic funding request option is what you have experience with and what you have done in the past. This is where the CCM would inform the Global Fund of the components in the funding request, the submission pathway choice, and the window selection, but the CCM would be the primary actor responsible for completing the full funding request documentation. And that would include the performance framework and the detailed budget at the level of the whole funding request. So that will be one PF and one DB for the whole funding request. And that would be submitted to the Global Fund, then undergo TRP review, and then the grant making negotiations would start after the TRP review and the TRP comments. Next slide, please. If you are thinking about these different options, I want to emphasize that it is the CCM's choice whether or not to use the classic submission pathway or the grant-ready submission pathway. And if you are having a grant that is ending at the end of 2026, that decision would need to be communicated to the Global Fund quickly after the allocation letter in order to be able to set up the documentation that is necessary to complete to be able to submit your funding request. We would encourage you to do that within 1 month of the allocation letter being shared with you, if you are aiming for window 1 submission. If you think about how this would work in terms of options and timing, for window 1, there is about 3 months between the allocation letter and the submission of the documentation. That is certainly sufficient to develop a funding request, as we have seen you have done in past grant cycles. It may be a bit more challenging to develop the grant level PF and detailed budget in that period of time. However, it would then give you a bit more time for the grant making after the window 1 submission. If you are submitting for window 2, you would have probably almost 5 months to develop the submission package. And so that's certainly sufficient time to complete not only the funding request development, but also the grant level performance framework and detailed budget. And so the grant ready submission option may be a very good one to consider if you are aiming for window 2, because it would reduce the time that you would need for grant making after you get the TRP response to your funding request. Next slide, please. In Grant Cycle 8, the Global Fund will be using our partner portal for the submission of the funding request. It is an external interface of the Global Fund's grant operating system that is already used by principal recipients, by LFAs, and by the Global Fund to interact with these actors. It has already been set up for CCMs, and CCMs, you are probably familiar that some of your activities are now in the partner portal. We will be creating a portal access specifically for the funding request, and that will be going live. We expect that to be live in March. And so that is where the Global Fund will put documents for the CCM to download, and it will be where the CCM will be able to attach documents for the funding request submission for Grant Cycle 8. You will be hearing more about the partner portal in specific clinics or training sessions for the CCMs that register for Window 1 and Window 2. We'll be doing those in a little bit later on this year once that system is live. However, what you can be doing right now, next slide please, is to update your grant entity data. The grant entity data needs to be established in advance to make sure that the right people have access to the specific funding request module in the partner portal. And so the CCM focal point will be established as a funding request submitter and will have the ability to create new contacts and to identify amongst the CCM existing contacts who the submitter should be and whether or not there need to be additional editors. An editor is able to download the documents and then attach the documents. And if it would be helpful to have one of your TA providers or a consultant that is supporting the development of the funding request be an editor, it is possible to create that contact for that person, even if they're not a member of the CCM, to allow them to become an editor for the funding request module. I'm going to pass on now to my colleague, David, who is going to now take you through the content of the funding request for the full review submission.
Hi, thank you, Lindsay. Again, my name is David Nash Mendez, and I will be walking us all today through starting with the funding request form and then getting to the complete application package. So our goal for developing the full review application package for Grant Cycle 8 was to drive impact while reducing effort. We really tried to only ask for what was needed and to only ask for it once. So of course, we also needed to make sure that the application package supported applicants with realizing the strategic shifts, supporting integrated approaches rather than making it more difficult. We hope that you're happy with the results if you've already looked through them. The forms and instructions are about 60% shorter than they were for Grant Cycle 7, with fewer annexes as well. So let's go through the next slide. We'll start with the funding request form. It has 4 sections: country context and priorities, funding request and rationale, sustainability, domestic financing, co-financing, and resource management, or mobilization, rather, and implementation. And I'll signpost clearly as we move through each. So let's go to the next slide. Before getting into the questions, though, a reminder on the instructions. The approach to the instructions will be familiar to anyone who developed a funding request in Grant Cycle 7. Each question in the form points to instruction elements that define a complete answer. Pay attention to the details column. It clarifies what needs to be covered within the answer, and you can use this structure to avoid gaps or duplication. Similar to Grant Cycle 7, we're developing an example funding request to demonstrate how responses to the forms can be structured using a fictional country as an example, and we're expecting to publish this resource later this month. Let's go to the next slide, please. Section 1 on the forms focuses on context and existing national priorities. By existing, we mean that they should be country-owned priorities for country-owned programs, independent of the Global Fund. Next slide. In Grant Cycle 7, respondents to the applicant survey were incredibly supportive of the Tailored for National Strategic Plans application approach, saying it was more straightforward to fill out the forms, and it saved significant time over the other application packages for that cycle. The TRP was similarly positive about the quality of the NSP approach funding request that it saw. And so based on these great results, we decided to bring forward this approach to the full review for Grant Cycle 8 so that all core high impact applicants can reference national plans rather than repeating content in the narrative. So we start off the forms with question 1.1a, which we are calling the country context table. This is where applicants cite the sections of national documents where the country context can be found. And when national documents are not available or are missing key information in that details column, again, applicants can provide that narrative in the box at the bottom. Let's go to the next slide. Question 1.2a is on integration priorities. It asks applicants to describe how integration plans from the country context table are being put into practice. Applicants can use the integration technical brief, which was published in December, to think across services and systems, looking at how HIV, TB, and malaria services are integrated into primary healthcare and how RSSH functions support them. Again, these plans for integration should be country owned, and plans do not need to be limited to program areas supported by the Global Fund. Let's go to the next slide. Now we're getting to section 2 of the form, funding request and rationale. This is where applicants explain how funding will be used and why priorities were chosen. Applicants will present prioritization and matching funds, if applicable, as well as the rationale behind the prioritization choices. Let's go to the next slide. For question 2.1a, applicants are asked to highlight up to 3 strategic priorities per component, RSSH, HIV, TB, malaria, as applicable, and to explain why each priority was selected. And this is not to be a complete list of priorities for the national programs, as these were referenced in section 1 in the country context tables. Instead, this question should be building off of the national priorities and describing the priorities for the funding request itself. Let's go to the next slide. Question 2.1b is for the prioritized request and rationale. For grant cycle 8, applicants should again use the prioritization tables to describe what is being requested for financing from the Global Fund. Starting with RSSH and grouping all modules by component, they should include one table per module that briefly describes the activities for each intervention and describes for the entire module how the investments maximize impact, improve integration, support sustainability, address critical gaps, and advance other goals, which are in that details column in the instructions. And again, we're asking for the impact at the level of the module, not for the impact at the level of each intervention or activity. Let's go to the next slide. Question 2.1c is for applicants using payment for results. If they're using a payment for results modality, they can outline the arrangements and how the accuracy of the results will be ensured. Payment for results can cover part or all of the request at the level of the program. However, incentive payments belong in section 4 implementation, which we'll get to. And if you're not using if you're not using payment for results, just say that you're not using payment for results and go to the next question. So let's move forward. Question 2.1d is really about the prioritization approach or the methodology used to select the modules, interventions, and activities included in the prioritization tables. This may seem similar to some of the previous questions, but question 1 asks about existing national priorities. Question 2.1a asks for the strategic priorities of the funding request. And this question asks for the process and rationale of how those top 3 priorities for the funding request resulted in the modules, interventions, and activities that were selected and described in the prioritization tables in 2.1b. We know that this prioritization is going to be especially challenging in a context with fewer resources, so it's really important to explain the how and the why of what you chose to include in the funding request. Let's go to the next slide. Building on existing investments. Question 2.1e asks how GC8 investments build on existing investments, which include not only previous investments from the Global Fund, but other domestic investments, other external investments, or investments from other donors. If applicants are proposing disease-specific or standalone systems and services, they will need to provide a sustainability approach for those investments, as well as a rationale for using a siloed approach. This is a new question, but as we are really encouraging integration with GC8, it's essential that with these investments from the Global Fund, that we're not building new silos, but we are leveraging the existing investments that have already been made. Let's go to the next slide. This is on matching funds, question 2.2a. If the allocation letter designates matching funds, applicants will need to describe how the funds have been incorporated into the funding request and how the conditions have been met. Detailed guidance on matching funds will be published soon, and we'll also have an information session on allocations and matching funds coming up in March. Let's go to the next slide. We're now halfway through the forms, section 3. This section focuses on progressive financing and preparing for effective transitions, looking at sustainability and transition planning, domestic financing and co-financing, and any innovative finance being explored or underway. This is an important topic that we won't have enough time to do justice for today, so I definitely recommend attending the upcoming session on sustainability, transition, co-financing, and value for money, the rescheduled dates for which will be shared soon. Let's go to the next slide. Question 3.1a is on challenges to sustainability and transition. With so much of the strategic shifts focusing on delivering effective transition to full domestic financing for health and of integration of services into primary healthcare, this question is quite important. It's asking applicants to explain how the request addresses sustainability and transition challenges, looking at both programmatic and financial sustainability. Responses to this question should build off of the macro level context discussed in the country context table, and responses need to be aligned with the funding landscape table. Let's go to the next slide. In questions 3.2a and b, applicants are asked to report progress on co-financing in GC7, to present expected trends in grant cycle 8, and to describe the specific commitments to be formalized in the commitment letters. Responses should be consistent with the funding landscape tables and the programmatic gap tables. Aligning on the co-financing commitments is always important, so we're recommending as a good practice that these conversations begin early to make sure that the commitments are really setting countries up for an eventual effective transition. To note, commitment letters are required before grants can be signed for the full allocation amount. This is not a new expectation, but it will be more strictly enforced in GC8, with portions of the allocation ring-fenced or set aside until the letters are received. Let's go to the next slide. On question 3.3a, and this is for applicants using or exploring the use of innovative finance to fund their responses and health systems. If applicable, applicants are asked to outline innovative financing approaches, including both traditional and non-traditional domestic revenue opportunities. And this question is not just about current efforts, but can also include readiness for innovative finance or plans to explore innovative finance. And if CCMs are considering innovative financing for GC8, they should already start discussing it with the country team. Let's go to the next slide on implementation. This last section covers how grants will be implemented and how program design risks are mitigated. It includes details on implementation arrangements and key risks. Let's go on. Question 4.1a is on implementation arrangements. And as you'll soon see, the implementation arrangements map is no longer a required funding request annex. However, there were a few elements included on the maps that were still needed at the funding request stage. So going back to our development philosophy for grant cycle 8, we're only asking for this information now when we need it. So what we're asking for instead of the map is a streamlined implementation arrangements table, where applicants are asked to list all of the PRs and the SRs, repeating the table for each PR and adding rows for all subrecipients. For each of these, they should indicate whether they are new or continuing, and the level of implementation, so at a national or subnational level. They should do this using the form drop-downs. And on the website, the PDFs for the forms are already available, but it's not obvious that there's drop-downs there, but when you have access to the Word versions, I promise you they're there. And so we hope that you find this approach to providing this information a lot less effort to respond to than developing the implementation arrangements maps. Let's go to the next slide. Question 4.1b is applicants are asked to describe changes from grant cycle 7 to maximize effectiveness and value for money. And this is where some of that focus on the strategic shifts that we mentioned earlier in the presentation of simplifying implementation arrangements and working on value for money, where these can be demonstrated in the forms. This question is also important for showing programmatic sustainability, where local entities are not already principal recipients. Applicants show how capacity will be transferred. They should also consider how to better include community-based and community-led organizations in the implementation arrangements, and considering how to remove barriers to roles in the implementation arrangements. Again, there will be an upcoming session on sustainability, transition, and co-financing that I encourage you to attend. Let's go to the next slide. Finally, this is the last question in the forms. So 4.2a looks at mitigating program risks. The approach to risk in the forms for Grant Cycle 8 is very similar to what we used in Grant Cycle 7, in that we're not asking for all of the risks to the programs. Those are still important, but these are instead considered during the grant making steps. Instead, this section is focused on 4 specific risk areas that often have risks that can only be mitigated through changes to the very designs of the programs, which would then possibly require coming back to the TRP, since the design of the grants would be structurally different than what had been reviewed in the funding requests. And so that's why we're asking about these specific risk areas now and not others. Next, we'll go into the required annexes included in the funding request package. So these are the different annexes and the attachments which are already included for the full review. If you were around for this presentation in Grant Cycle 7, I'm sure you can already appreciate that there are a lot fewer annexes on the slide than last time. On the furthest left row are the annexes that detail what is going to be funded and what the goals will be. Next row to the right, we have the plans and the priorities which informed the request, as well as the priorities for what would be funded if financing became available. Third row, we have the data, the assessments, and the analyses which support the prioritization in the plans. Finally, we have documentation needed to ensure that Global Fund requirements are met, such as those related to country dialogue. And we have fewer annexes than before, but that's not to say that the content from the discontinued annexes isn't still important. It's just been moved or reconsidered, going back to that design principle, asking for what we need when we need it. For example, the sexual abuse and harassment risk assessment has been integrated into the grant-making stages. Key questions from the RSSH Gaps and Priorities Annex have been integrated into the full review form, allowing applicants to point to national health sector plans rather than reiterating existing priorities. And the health product management template is no longer a requirement for the funding request submission, and we'll cover that later. Let's go to the next slide, please. So we already covered in detail the funding request form. So next we'll get to the performance framework and the detailed budget. The performance framework lays out impact, outcome, coverage indicators, and work plan tracking measures where needed. And it includes related targets against which results will be reported throughout the life of, or throughout GC8. The detailed budget shows what will be spent and when across modules and interventions. In grant-ready funding requests, principal recipients will complete the online PF, the performance framework, on the partner portal and complete the detailed budget in Excel and submit both to the CCM through the partner portal. While one is developed in partner portal and one in Excel, in both cases, it's the CCMs which are then responsible for submitting the documents to the Global Fund via the partner portal as a part of the full package, going back to the required annexes on the previous slide. There's also an information session coming up on the performance framework and detailed budget with some other annexes. That's coming up on January 28th, and we'll go into more detail on these annexes during that session. Let's go to the next slide, please. We have 2 annexes here that are both really important for the prioritization of the funding request. Funding requests should start from robust, costed, and prioritized national strategic plans and national health plans that reflect the overall national health strategy, and these are a required part of every funding request package. The funding priorities of communities and civil society is a continuing expectation from Grant Cycle 7, in which applicants list up to 20 top priorities that communities and civil society consider to be the most valuable and highest impact investments. Let's go to the next slide. Programmatic gap tables summarize programmatic needs, targets, and gaps. For Grant Cycle 8, the HIV and the TB tables were considerably redesigned to have more automated calculations and fewer fields that applicants need to fill in themselves. They've also been aligned with the funding landscape table and PAR, so it's easy to just copy and paste the gaps across the tables. We'll show you how to do this in the annexes session next week. So again, I encourage you to attend. For malaria, for the malaria gap tables, we are asking for submission of the RBM Partnerships malaria gap tables rather than the tables that we had previously developed ourselves. So before, in grant cycle 7, both the Global Fund and the RBM tables were expected to be developed, but since they covered more or less the same information, we found we could remove this duplication and are instead only asking for RBM's tables. The funding landscape tables show total need, expenditures, sources, and gaps. For grant cycle 8, there's differentiated requirements. Some tables, such as the detailed disease financial gap or the health product tables, don't need to be completed if certain criteria are met. Again, this is going to be covered in the session next week. Let's go to the next slide. Similar to previous cycles, the prioritized above allocation request allows CCMs to show what they would have included in the funding request had more funding been available. And this should not be a wish list, but needs to be prioritized. We recommend no more than 10 rows per component in grant cycle 8. The assessment of equity, human rights, and gender-related barriers to health services asks for an integrated look at what used to be separate requested assessments of human rights barriers and gender-related barriers. So we're still asking for assessments of these barriers, just in a more integrated and holistic way. And as noted, we're recommending an integrated assessment, but standalone assessments can still be submitted if that is what is available. Whether one assessment or several, these are a requirement for high impact portfolios and are asked for if available for core portfolios. Let's go to the next slide. Sustainability and transition documentation directly relates to Section 3 of the forms on sustainability, domestic financing, co-financing, and resource mobilization. These should be included with the funding request package if available. And the CCM endorsement and CCM statement of compliance are not new and continue to be an important part of the funding request process. Let's go to the next slide. Finally, we have the Health Product Management Template, HPMT, which is, as Lindsay mentioned, is not part of the funding request package. And we distinguish this because the funding request package is submitted by country coordinating mechanisms, and the HPMT for grant cycle 8 is submitted by principal recipients. The HPMT is also not reviewed by the technical review panel. For grant cycle 8, only PRs requested to complete grant level performance frameworks and detailed budgets for the grant ready funding requests are required to complete the HPMT during the funding request period, which they do online through the partner portal. The HPMT is not available offline. It is an online only tool and is only available to principal recipients which have been nominated for grant cycle 8. If a CCM is completing the classic funding request, they can request the nominated principal recipient to complete the online HPMT if that's helpful. Otherwise, health product information can still be presented using the HP tab, short for health products, on the detailed budget. Let's go to the next slide. So now we'll cover how to submit the funding request. Oh, we skipped one slide ahead, but that's totally fine. There's going to be a more detailed training in April for countries with funding requests registered for window 1. We'll let you know more information about that later. So if we can go to that next slide then. In grant cycle 8, all funding request documents are submitted via the partner portal. The module shows the status of completed and missing documents. You can see the checklist of green and a few red X's where the documents are missing. And once all the required documents are attached, the funding request can be submitted. And again, we'll have more information coming up on the partner portal in training coming up before window 1. So with that, we will finish with resources and next steps, and I will hand things back to Lindsay to also carry us through that as well as the questions, which I have definitely seen rolling in. Thank you.
Thanks very much, David. So let's go on to the next slide. We'll do a recap of some of the resources that are available to you. Already on the Global Fund website, there has been a selection of core guidance that is encouraged that anyone that is involved in the development of the funding request reviews before they start working on the funding request. There are HIV, TB, malaria, and RSSH information notes. Those are the core investment guidance from the Global Fund. The Modular Framework Handbook provides an update of the modules and interventions that have been identified for Grant Cycle 8 grants. that underlies the performance framework and the detailed budget. It is used in the PAR and in other reference documents as well. And then there are the other technical briefs and guidance notes that are around specific thematic areas. These are the core documents that we would encourage you to review, and they're available on the Global Fund website. Next slide, please. On the website itself, you will find information about these information sessions. Some of them have happened already, and some of them are still to come. The recordings for these information sessions and the PowerPoint slides in English, French, Spanish, and most in Portuguese as well are available on the Global Fund website already. So you are able to access those in the information session section on the Global Fund website, and if you go into the applying for funding section. Next slide, please. There are key messages there. There are applicant guidance materials, including the PDFs of the application forms and the annexes that David just took you through. We will shortly have the example funding request that will be published as well as a model of how you could think about having an integrated single funding request for all of your disease components. The additional technical guidance, investment guidance, and instructions for completing the funding request, those are all available on the Global Fund website. Next slide, please. So just as a recap, what are the next steps that you should be thinking about now and how to prepare for the funding request after you get the allocation letter? One of the most practical things you could be doing now is to already be thinking about having your CCM focal point start identifying who will be the editors and the submitter of the funding request for the Global Fund, and then making sure that information on those contacts is updated in the grant entity information section of the partner portal. The CCM should already be planning the meetings to discuss the PR nomination, the program split, and the funding request submission pathway, whether or not you want to pursue the classic or the grant ready submission option. In addition, the CCM should be planning and scheduling the country dialogue meetings that will be the key input to the funding request priorities. Once you receive your allocation letter, you will then need to match up those priorities to the funding that is available after you make a decision on program split. And then after the allocation letter is received, the CCM will need to be communicating with your country team your decisions around whether or not you will be including all components in the same funding request or having two or more funding requests, your submission window that you're targeting, your submission pathway, if it's classic or grant ready, and then informing the CT once you have nominated your principal recipient for grant cycle 8. For principal recipients, after you've been nominated, you can start then engaging in the preparations for grant cycle 8. You might need to, if you've been selected for a grant-ready funding request, for example, you may need to update your own editors and submitters in the partner portal. And then you would need to complete the grant level performance framework, detailed budget if that grant-ready pathway is selected. Principal recipients who have been identified by the CCM can also help support the development of the funding request, even in the case of a classic funding request submission pathway. And they could, for example, develop the HPMT, which is only available online to PRs in the partner portal if they're nominated early for either the classic or the grant ready pathway. Next slide, please. We're at the stage for questions and answers. And I must say, you guys have been really active about putting your questions into our little question box. So you can see that on the bottom of your screen with a little question mark. If you have questions, we'll try to answer most of them now, recognizing that we have a half hour for answering these questions. So we'll answer as many as we can in the next half hour. If the content of the answer will be covered in a future webinar, we'll just mention that, and you can then attend the subsequent webinar or look at those slides to have the answer to that question. Okay, so let's go into the questions, and some of them already have some proposed responses from some of my colleagues. Thank you so much. Some of these other ones I will try to answer on the spot. And if colleagues have suggestions If my Global Fund colleagues have suggestions how to respond differently, you're welcome to come on screen and support the answers to some of these questions. Okay, so the first question is, among the strategic shifts, one of the strategic shifts for the Global Fund for Grant Cycle 8 is to accelerate the scale-up of new health product innovations. Does this include the scale-up of new technologies? Absolutely. So health product innovations could be treatment options, it could be equipment, it could be diagnostics. This is all covered as part of the innovations that are available that could help all of us in this public health ecosystem become more efficient, more effective, and drive more impact. So those types of innovations would be considered as part of what we would encourage countries to accelerate in their adoption in Grant Cycle 8. Question 2, by what percentage is the reduction or difference in Grant Cycle 8 versus Grant Cycle 7? So the short answer to that question is Grant Cycle 8 has a proposed sources of funds for the allocation of around 11 billion. And in Grant Cycle 7, we had a proposed sources of funds for the allocation of around 13 billion. In addition to that, there was also some C19 RM funding that was still available in Grant Cycle 7. So there will be a substantive reduction in Grant Cycle 8 versus the funding that was available to Global Fund countries from the Global Fund in Grant Cycle 7. I can't tell you exactly the amount for HIV. This would be a deductive part of the allocation methodology. Once the sources of funds for the allocation is confirmed by the board, then the disease split would be applied. And then that would then impact how much funding would be available for HIV across all of the Global Fund portfolios. Question 3, will the allocation letter propose a split amongst HIV, TB, and malaria as before? Yes, the allocation letter will propose the Global Fund's recommended split for the total country allocation between HIV, TB, and malaria. It will then be up to the CCM to determine the program split, which would include any investment in RSSH. Question 4, is there a limit for investments for RSSH? The answer is there is no limit for investments in RSSH. And in fact, investments in resilient and sustainable systems for health are essential as a foundation for a strong public health response and for a strong HIV, TB, and malaria response. So the Global Fund continues to recommend investing in RSSH on a cross-cutting basis at the level that will make the biggest impact for the country overall. Question 5, will there be a quota system for community system strengthening within the resilient and sustainable systems for health, given that community system strengthening budget is always marginalized? So that's an opinion, and I can respect that opinion. And indeed, there will be an encouragement to invest in community system strengthening within RSSH. There is not a mandatory funding amount for community system strengthening, but it will be an area that the Global Fund will be looking at and will be expecting to see, especially in our high impact portfolios. Question 6, given the directive to integrate grants and streamline PRs, is there any guidance on whether countries still need to maintain at least 2 PRs? And this is referred to as dual track financing. And this remains an intention of the Global Fund that where possible, we should ensure that there is a balance between government, principal recipient, and civil society or community, either principal recipient or SR, subrecipient. So it's not a mandatory situation that we would expect that there would always be two PRs for every portfolio. In fact, as we look ahead to preparing for transition and sustainability, it does make sense for consolidation under one PR, as long as we have a strong SR that represents our civil society and our communities' investments. It is also possible for a government PR to be able to effectively ensure implementation of those types of programming areas. So it is not a mandatory that there must be a different principal recipient to be able to execute those interventions. Question 7. To support grant-ready funding requests, should we anticipate any updated budgeting guidelines in the coming weeks and months? So yes, the budgeting guidelines are being revised for Grant Cycle 8. Once that is completed, it will be published on the Global Fund website. So that is currently under revision. We want to make sure that it includes the right information to be able to support applicants when they start preparing their budgets for Grant Cycle 8. So that will be available after the allocation letters, or before or just after the allocation letters are sent out to countries. Next slide, please. Does a change in implementation from PR1 only to a PR1 and PR2 arrangement, or vice versa, require approval from the Global Fund Secretariat? Yes, changes in principal recipients require Global Fund approval. It is the responsibility of the CCM to identify, to nominate the principal recipient or principal recipients, and any change in the principal recipient for between one funding cycle to the next funding cycle would require a discussion and the approval of the Global Fund to move forward with that change in implementation arrangements. Question 2 on this slide. Can grant ready option be available for window 1 as well? Absolutely yes. The grant ready or the classic funding request submission pathway is available in any of the windows. Recognizing that the allocation letter will be sent out in early March, there is a shorter time period to have the grant level performance framework and detailed budget ready for window 1, but it is absolutely possible if there's a strong PR and if the CCM is very clear on the investment priorities, it is absolutely possible to have that ready for a window 1 submission. If that is the intention, the CCM would need to notify the country team of that intention within 30 days from the allocation letter being sent out. Question 3 on this slide. For the grant-ready funding requests, is it recommended that CCMs prioritize working with former PRs? Let me just say that that's not what the Global Fund is saying, yet the Global Fund data will show us that more than 80% of the principal recipients in Grant Cycle 7 were also principal recipients in Grant Cycle 6. We see a very strong correlation between strong performing PRs being maintained by the CCM as they vote on their PRs following the CCM eligibility requirement. We see that strong PRs are often reselected between one grant cycle and the next. So we would expect that there would be a strong basis of existing principal recipients being retained for Grant Cycle 8. So let me read as well the response provided by my colleague. CCM should follow their processes to ensure a fair and transparent selection of PRs based on their own selection criteria as required by CCM eligibility criteria 2. The CCM is encouraged to complete the PR selection process early to provide clarity on the implementation arrangements early. Where the CCM chooses to continue to work with the GC7 PR, then they're eligible for the grant-ready funding request process, which allows you to advance some of the grant-making negotiations to the funding request time period. Question 4 on this slide. Can a country take the grant-ready funding request submission pathway without selecting or identifying subrecipients? The answer to this is yes. We are asking in the funding request for information about implementation arrangements, including subrecipients where that information is available. But it is not required to have the subrecipients identified at the time of the funding request. So the response from my colleague, it is only required that the principal recipients are identified and are continuing PRs to be able to be eligible for the grant-ready funding request submission approach. Of course, the earlier that subrecipients can be identified, the better, because this provides a fuller picture of implementation and allows more detailed and accurate development of the core documents, including the performance framework, the detailed budget, and the health product management template. Identifying the subrecipients and ensuring that the terms of reference and contracts are in place before the implementation period start date is a key element of implementation readiness. This remains a priority regardless of the submission pathway in Grant Cycle 8. Next slide, please. Question 1 on this slide. Having a principal recipient nominated early makes sense. However, is the Global Fund requiring to complete the subrecipient selection early on? So I think I've already answered this question. Yes, we encourage it, but it is not required. Question 2, could you provide more clarification on the Grant Ready versus the Classic version? So I would encourage you to go back to the recording, which is available on the Global Fund website, will be available on the Global Fund website after we complete this information session. It will probably be uploaded tomorrow, and the slides are already available for you to review in advance. More information will also be made available to CCMs and to principal recipients in the coming weeks. There will be an updated operational policy note, and CTs will also be able to, your country teams will also be able to support you as you think about whether or not the Grant Ready or the Classic funding request is more appropriate for your portfolio. The next question, question 3, is about the HPMT. When will the HPMT file be submitted? How can countries consider the budget for procurements at the funding request stage without the HPMT? Okay, so details on the HPMT and the detailed budget will be covered in the Annex information session next week. So the HPMT is only going to be available online, and it's only available to principal recipients, which is why it's not mandatory for the funding request submission, because that is prepared by the CCM alone, and it is not reviewed by the technical review panel. But obviously an HPMT is a helpful input to the detailed budget, and we would encourage the development of the HPMT early where that is possible in the country context. Next slide, please. Will the LFA, the local fund agent, be required to review the online HPMT tool, given that the HPMT will not be included in, it says here, the grant application package? What I want to clarify, though, is that the HPMT is required for the grant application submission. It is not required for the funding request submission. The scope of the LFA review will need to be discussed and agreed between the LFA and the country team for each specific portfolio. If the LFA is requested to review the HPMT, then they will be able to receive an extract of the online HPMT. Question 2 on this slide. Will offline Excel-based files be available to help assist with document preparation amongst the different stakeholders for the PF, the HPMT, and the DB, even if the CCM selects the Grant Ready option? Okay, so for the Classic funding request, the performance framework and the detailed budget will be done in Excel. And yes, that is available to be circulated for input, for consultation, and then the final version of the Excel is what is then attached and submitted to the Global Fund. The HPMT is not required at the funding request stage, although CCMs, if they nominate principal recipient early, they can request that that principal recipient complete the online HPMT. For the Grant Ready funding request, the PRs will complete the performance framework and the HPMT online. They can produce an extract in an Excel collaboration file. However, if there are changes in the Excel collaboration file, they would have to be input into the performance framework online form. The detailed budget will continue to be in Excel. Question 3 on this slide. Is there a complete list of all of the portfolio categorization of the countries and components for GC8? So the countries that will receive an allocation for Grant Cycle 8 has not yet been confirmed. This decision can only be made after the board confirms the sources of funds available for the allocation and the Global Fund completes the allocation methodology. At that point, we will know the final list of countries that will receive an allocation for Grant Cycle 8. And after that decision is made, then the Global Fund will publish the list of the portfolio categorization for the countries that have been determined to receive an allocation for Grant Cycle 8. The portfolio categorization will be communicated in the allocation letter before it's confirmed on the Global Fund website. Question 4 on this slide. If large pledges come in after the board meeting when the sources of funds are determined, how will the Global Fund handle the distribution of that pledged funding? So the answer to this question is we will see. We have lots of different methods that we could use to apportion the funding, and it will depend on how large the funding is, and therefore how we approach the distribution of that funding. So one option could be that we designate funding across a wide range of portfolios, and then countries that have identified their prioritized above allocation request and have unfunded quality demand would be able to integrate that funding into their grant in a grant revision. Similarly, the Global Fund could use the portfolio optimization exercise once that source of funds has been confirmed by the Audit and Finance Committee as available. And then similarly, unfunded quality demand could then be used to identify where that funding would be designated, and a grant revision could integrate the funding into the grant. Next slide, please. Question 1, within the Community System Strengthening and RSSH framework for GC8, not sure we have a framework for GC8, how does the Global Fund encourage principal recipients to leverage the expertise of specialized local technical NGOs? Okay, so CCMs with their oversight, country teams with their expertise, and principal recipients as the grantee that is receiving the funds from the Global Fund and responsible for implementation all have a voice in the identification of the most effective implementation arrangements to ensure that the objectives identified in the funding request are effectively implemented and delivered. So I don't have a specific answer to this question of whether or not there's a framework to identify community system strengthening subrecipients, but I can certainly guarantee you that this is the idea of selecting the strongest implementation partners is one that the Global Fund is very committed to and is very country specific. And so as the selection of principal recipients is a CCM eligibility requirement, that it is done in a transparent and documented way following the requirements identified in the CCM's own operational guidelines. Similarly, a principal recipient would have to go through capacity assessment to understand whether or not a potential implementing partner would be the most appropriate for that specific area for implementation. Question 2 on this slide. I noticed that the following question has been removed from the implementation section in the application form. Describe the role that community-based and community-led organizations will have in implementing programs supported by the Global Fund. Presumably, this is still important to describe. Where should this go in the new template? Okay, so in question 4, which is around implementation arrangements, 4.1a that David showed you as a drop-down box, it does already request information on the type of implementer that has been identified at the time of the funding request development. And then question 4.1b requests information on barriers to inclusion of community-led and based organizations and implementation. Specifically, there is an instruction to describe if the changes to implementation arrangements address existing key gaps or barriers to the role of community-led organizations in implementation, including barriers to access funding and operate. So anything related to the role of community-based and community-led organizations and implementation has space to be covered in responses to questions 4.1a and 4.1b. In question 3 on this slide, in section 2.1b, In GC7, it was difficult to put activities and details in a short manner while listing interventions, because how much detail and how long should the document be? So the response is the example funding request for GC8, which will be published on the Global Fund website in the next few weeks, was developed with the support of the technical review panel and demonstrates what the technical review panel has found to be an appropriate level of detail in order to respond to the question. So once that is published, you'll be able to look at that example funding request to understand how much detail and how long the response should be to that type of question. Question 4, how does one funding request look like? So in the example funding request, you will be able to see how a funding request that includes all of the disease components, HIV, TB, malaria, and RSSH, can be structured together in one funding request. This will be published soon in the next few weeks and will be available in that applying for funding section of the Global Fund website. Next slide, please. Okay, let me just make a point to my Global Fund colleagues who are also online. I see that it's 3:22, so we have just a few more minutes to answer questions. If there are really important questions that you've seen coming up that we may not get to, could I kindly ask that you would adjust them in the slides to make sure that we get to them in the next 5 or 6 minutes? Thanks. Question 1 on this slide. How will conflict of interest be managed and ensure inclusiveness in the funding request if the PR completes the detailed budget and performance framework with the grant ready pathway? Okay, so the answer that my colleague has written, I'll read out. The CCM remains responsible and accountable for managing the country dialogue process and ensuring an inclusive process, considering the national priorities and balancing those with the funding that's available to determine the priorities that would be funded by Global Fund allocation funding. So it is the CCM that sets the priorities for how allocation funding needs to be used, and this needs to inform the development of the performance framework and the detailed budget, which would be done by the principal recipient, who would be nominated through a fair and transparent process, but under the oversight of the CCM. It is the CCM that would then look at the grant that this PR submits, or the PRs, plural, submit, to then make sure that the grant matches the priorities that they have identified and documented in the funding request itself. So this builds on a recommendation from GC7 to involve the PR earlier in the development of the funding request, and also reflects the reality that many programs are ever more mature, as we have had now many cycles of funding from the Global Fund, with long collaboration between the CCM, the principal recipient, and the Global Fund. So it is the CCM's responsibility to ensure inclusiveness in developing the priorities of the funding request. And it's also the CCM's responsibility to make sure that the performance framework and detailed budget match the priorities, even if the detailed grant level PF and DB have been developed by the principal recipient. Question 2 on this slide, is it possible to identify SRs at the grant writing exercise? It's absolutely possible to identify SRs as early as possible, and this improves implementation readiness. So this could be something that the PRs with the CCMs are already considering now. Question 3 on this slide, on sustainability, is it only tied to government allocation, or will it also capture other funding outside the Global Fund and the national government? Sustainability considerations primarily would be looking at domestic funding or funding available to the government that has been committed in a long-term loan from the World Bank, for example. But sustainability is not about short-term donor commitments. It is about a longer-term plan for increasing the domestic ability to be able to fund the National Health Program independent of donor funding in the future. Question 4 on this slide. Would you be able to provide further insights into how the integration process will work? This will be covered in detail in an upcoming information session. I believe it's scheduled for next week, and if I'm wrong on that, then I would kindly ask one of my colleagues to correct me. But that information on that session is available on the Global Fund website. You can register for that information session. I think it's on Monday. Question 5, could you explain a little bit more on the option of submitting one funding request for all disease programs, including RSSH? I think we've covered this already. The idea is that by considering the allocation holistically, looking at the whole allocation that is available to a country, then the applicant, usually the CCM, would be able to then optimize within the holistic amount designated for the country instead of having a siloed look at the disease funding separately. So this is why the Global Fund is encouraging integration in the sense of being able to holistically prioritize, holistically consider value for money, and then use the opportunity of integration to be able to drive efficiency and impact. So instead of having 3 separate community health workers, for example, if we were to look at integrating that community health worker program, you would be able to drive more value for money, more effectiveness, and ideally more impact. So this is why we're asking you to consider building out the funding request, not in silos, separately within the 3 different diseases, but to bring together that thinking and that planning as you develop the funding request holistically. Question 6 on this slide. Will we have a section for communities to write their priorities? And the answer is yes. There is a required annex that is called the Funding Priorities for Civil Society and Communities, where we're requesting that the civil society and community groups come together to identify their top 20 priorities to inform the CCM as they identify the priorities for the total allocation funding. So the earlier that is developed, the better. It can inform some of the decision-making, and then that decision-making can then be cascaded into the performance framework and detailed budgets that are submitted alongside the funding request narrative. Okay, do we have time for a couple more questions? Is there a last slide? Okay, I'll try to get through this slide and then we'll be done for this information session. Question 1 on this slide, is there a pandemic preparedness section? Pandemic preparedness is considered at various points in the form, but there is no standalone question. It could be referenced in the country context table and then mentioned as relevant when answering the other specific questions in the form, but there isn't one standalone section on pandemic preparedness. Question 2, will there be an offline performance framework that countries can use to draft inputs before entering the final information in the online portal? Yes, there will be a downloadable Excel version of the GC8 performance framework available for offline collaboration and draft inputs. And more around the performance framework will be shared in the session that's scheduled next week on the annexes. In that annexes information session, we will have the experts talk about the performance framework, the detailed budget, the programmatic gap table, and the funding landscape table. Question 3, when will the SDC guidance be on the website of the Global Fund? We are expecting that around the same time as the Global Fund board meeting in early February. So that is work in progress, and we want to make sure it reflects the most up-to-date input and guidance from the board, and so that's why the timings are linked with the board meeting in early February. Question 4 on this slide. Please specify whether all national documents should be submitted in English only. So the required funding request annexes can be submitted in English, Spanish, or French. National strategic plans and other national documents can be submitted in national languages, but the Global Fund annexes should be submitted in English, Spanish, or French. For GC7, the forms for RSSH and programs applications were not designed similarly. How to reconcile RSSH activities related to a single program application form. I'm not sure I fully understand the question, but I'll read the response that my colleagues developed. RSSH modules should all be included in one funding request, even if there are separate funding requests that are developed and submitted. More information on this is included in other information sessions, including the session on integration, which is coming up, and on applicant guidance, which has already taken place, and you can watch the recording of that and look at the slides for that on the Global Fund website. Okay, we're now at 3:30, and I'm sorry, but we need to stop the questions now. Thank you very much for all of your engagement and all of your interest. I hope I've been helpful, and I hope the presentation from my colleague David and the slides that I went through will give you more information about how you can start preparing now, and then how you can develop your funding request after the allocation letters are sent out in early March. So best of luck to everyone. I know it's a little bit daunting, but also pretty exciting as we think ahead to the next funding cycle. Thank you so much for your attention and your engagement. And I'm sure I'll see you in an upcoming information session in the next few weeks. Thank you and goodbye.